I'm the program manager, and I kind of oversee all the interns because I don't have a supervisor that's licensed here, so I wear both hats. And I'm a licensed marriage family therapist. I've been doing this about 2 years with them, but I started at Cost Pacifica like 10 years ago. I started actually with the Rape Crisis Center when I was an undergrad in Santa Barbara. Oh, wow. So that's where I started my first like volunteering and getting experience in this field, was the Rape Crisis Center. So I was very happy you called, and I was so happy you guys tabled at my event, so thank you for that.
No problem.
And so we do all the risk assessments for psychiatric placement or people that have mental health crisis for youth up to the age of their 21st birthday. As soon as they hit 21, then it goes to CARES. So we have a middle ground of the TAY population, the transitional age youth population, and we serve the entire Santa Barbara County. Sorry, I'm out of breath. I'm going up the stairs a few times. I'm like, okay, I need to get back to the gym. Like, still out of breath. That's so sad. And so we are contracted with Santa Barbara Behavioral Wellness. And I'll explain how we're staffed. It helps people understand sometimes why there might be a wait time, or we might try to contain something over the phone or send you to the ER instead of us doing it. I was fully staffed until like a month ago, and now I'm down to half the staff. It just, sometimes that happens. So I'll explain that in a minute. So we provide ongoing also. So we respond to law enforcement. We go into the ERs. We go and get calls from schools. Parents call us directly. And our population of actually youth contacting us is really small. Kids don't like to talk on the phone these days. They won't. It's like they look like they have a social disorder when they really don't. It's just the nature of the generation. So we always hand out the text line to crisis line to kids. It's 741-741. It's a national crisis text line for youth. We are not partnered with them because our county's not big enough, but we're working with them possibly because our program is in Ventura County too. So I'm hoping if I merge the two county, or like we just combine them, they'll say our population's big enough, and then they'll route the calls to us based on our zip code, and we'll get those calls, which would be nice. Same with National Suicide Prevention Lifeline, which is like a big resource in all because of that song that came out by Logic, and it's been really put out there, which is a good resource too. But they also they won't partner with us because we're mobile and we won't serve adults. So we're trying to work with them too, because we've gotten calls from law enforcement who are doing welfare checks like, well, we should call SAFTY. They know to call us. And we're trying to work with the community and the population to call us more directly. And I'm going to hand some of these out just so you guys want, if you guys want them, or I can leave them sitting here. If you guys want to just pass them out. I only had like 10 of them.
We can make more copies?
Yeah, I can send you the copy. This one was more for the schools, so I just gave you the one that's like not law enforcement, not ERs. So the school seemed more relative for you guys. And so we are 24/7 mobile crisis triage, and we do provide ongoing services. And so what that means is we can provide 30 to 60 days of in-home services where we do a clinical assessment and diagnose and kind of make recommendations for treatment, and we link them to long-term services. So that's if they have Medi-Cal. So those are really good for like your Medi-Cal clients, that they can be linked to us. And you guys can call us directly. Are there therapists in here, or you guys are counselors and see clients on a regular basis? You guys can link them directly to us by calling us. They don't have to be in a crisis necessarily. If you guys are noticing that your clients are kind of, their mental health or symptoms are increasing, or they're kind of making those statements, just give us a call directly. We don't mind at all. No call is too little of a call for us. People seem to think in the community like, oh, only call crisis if it's an immediate crisis, or someone's like an immediate, like it's almost like emergency services. No, we want people calling us before it gets to that point, before a client's attempting suicide, before they're attempting to kill their parent, before they're engaging in SIV behaviors, self-injurious behaviors. So that's our population. Sorry, all the risk behaviors: homicidal ideation, suicidal ideation, self-injurious behaviors. We do some aggression. It depends on really. that one, those kind of calls, we don't do ongoing for the people with physical aggression. We try to link them really quickly, but that doesn't mean we won't respond, or we won't try to say, if it's a tantruming child and the parent's calling us in the middle of the night, we definitely try to just coach that parent through the tantrum and see if we can kind of separate them, and is there anyone they can call for support. We try to use least restrictive means. So our philosophy is keeping the children home in their community with their family and their natural supports. That's our philosophy. We don't like to write holds. And in the wake of the tragedy of the fires, now we really have no psychiatric placements. We lost our one main closest hospital where we even do voluntaries with our youth.
And how is that impacting your work right now this week?
We've actually been able to find placement, but they're going away a lot farther. So LA, San Francisco. And for some of the people,
do you have to transport down there?
no, we don't transport. We have AMR transport. So we have county has a contract with AMR, and they do that. And so what our county does that's different is than all the other counties in California is law enforcement here, is not allowed to do psychiatric holds. So we do them. They want to. And we've been working really closely with law enforcement and involved in their crisis intervention training. And so you may have noticed some of that talk on the news of officers in our county, across the county, are being trained in crisis intervention. So they're not, going to lethal means right away, or or if someone's calling, the same house is calling the law enforcement several times, they're going to assign them a crisis intervention deputy to get them linked to services. So they're kind of working with mental health with us, so we have the least restrictive means. So these kids aren't going to juvenile hall, so people aren't going to jail, and they're not being shot at first right away or taken down with really aggressive means. So that's been really nice in the last year working with law enforcement. We see the difference when we're responding, and they're actually engaging with us when we're assessing the family and participating in the assessment in really helpful ways, which is really nice. So if we're having a hard time engaging, they're helping us engage with the family, and they're sitting and waiting. Our assessments take a while because we want to be very thorough. We want to do a really good safety plan and make sure we can keep the client safe in their house. So least restrictive means, what does that look like? So you've got a suicidal kid, right? How do we know to, safety plan or what? And we do a really thorough assessment, and we look at every aspect of the system and see who are their supports and their natural supports, not just for the client, but for that parent too. And maybe there's some respite or family member they can go to that night. And then we do follow-up care. So we follow up with phone calls that night or the next day, and sometimes we even go out in person the next day just to prevent hospitalization. Even if within 24 hours they end up in crisis again and we did have to write a hold, we don't look at that as a failure. We look at that as, okay, we exhausted every measure and now this is the route we're going to have to go. It might seem like that's a failure, but we look at it well, at least we tried and didn't go that route first. I will say we've written the most holds we've ever written in safety in the last 2 to 3 months. We were usually under 5% of all our calls. We get about 2,000 calls a year, and about 60 of those are in person. So 5% is not a lot. We're up to almost 20% because the lethality of the temps of the youth are so severe. There's no other option but to write a hold. So we've seen that increase with our youth. And since the current suicide increase in our county, we've seen that being some of the reason why the youth will say, well, so-and-so, my friend attempted, so now they've attempted, and they're in the ER and took 30 pills or jumped out of a building and broke something or things like that. Really severe attempts, or cutting their arms lengthwise, which is really severe. It's not superficial, it's deep. They had to have it sutured. My team has been very, what should I say? I've been having to do a lot of supervision in the last few months because they are taxed right now emotionally with the amount of work and the things that they've been seeing. So although we try our hardest, I don't necessarily feel like it's a disappointment we're going right to holds. It's we are seeing something very different in the last several months with our youth in safety.
Do you think that's happening nationally, or is that just something it is happening nationally as well? You're seeing that trend as well?
Yeah, I mean, you guys all see the posts of kids who've committed suicide in other areas of California alone.
Our crisis calls have gone up.
Mm-hmm.
I mean, just what we're dealing with. So it's interesting that even, in your line of work, you're seeing an increase as well.
Yes, and it makes sense too for you guys given what's going on in the community and our culture right now. We've actually seen a lot of that with women's movement and the Me Too. I think youth are feeling like they can speak up and they want to share their stories. So a lot of our assessments have a lot of disclosure in the past month and a half or 2 months also of sexual abuse or rapes, and this is the first time they're reporting it, and that's what's sending them into crisis because they're very triggered. So we're doing a lot of report and cross-reporting with them and the family and facilitating, some family therapy if they're afraid to tell their parents because they're afraid of the reaction, and we're kind of assessing that situation and getting them the help that they need. So we've seen a lot of increase of that reporting, which totally relates to your program. And we're so thankful for you guys to be here for the community. You're very necessary, especially right now. It makes sense that you guys would see an increase in that.
So you do all of Santa Barbara County?
Mm-hmm.
And in Lompoc, if there were to call go out and you were to come out, how far is it taking? Who is your closest clinician to someone maybe in Lompoc?
Okay, so I'll go into staffing. In my contract, I have 7 staff for 24/7. It's not a lot. So that's all the way to Ukiama, which we don't really get a lot of calls there, but all the way to Carp, to the Napomo border right there at the bridge. That's what we cover. Lompoc, Guadalupe as well. And I, during the day, usually have 3 to 4 people on and 1 on each side of the county. Whether it's 2 on each side of the county or 1, and then whoever that third one is, it could be a mix. And it depends. If someone's dispatched in Santa Maria, then I might send the Santa Barbara person, but that's a longer wait time because the drive from Santa Barbara is a little longer. We had that situation today. Someone on their free shift, like they can see clients and schedule their proactive sessions, get caught up. So they don't get that every week, but we had every single person dispatched, or 4 people dispatched today. So, and that is we've been a little slower because the schools in Santa Barbara are still closed, and it's finals week for high schools. So we've been a little slower than normal. That's how busy we've been. And then someone else will hold the line. So it just depends. And sometimes it depends on if everyone's dispatched, we got to try to triage that. And we're triaging the calls to see, okay, who's most eminent? What could we do to say, could we safety plan this one and get on the phone with the parents if they say the school's calling us? And it seems a little less risk than the other one. And they're open to talking on the phone, and they're talking about coping skills they're doing, and there's future orientation talk. There's a lot that goes into those risk assessments. I'm sure you guys know that, doing your own crisis calls and risk assessments, to determine what is needed. And also, if they already have services, that might mean can we facilitate calling your therapist and getting you in for a sooner appointment? We also call those providers for any call as long as we have an ROI. With the county, we don't need an ROI. We just call them and let them know we had an interaction with one of their clients. Sorry, I lost my train of thought when I distracted with that one. But, okay, so on the weekends, I'm going to go back to schedule. Weekends, there's 1 person for 24 hours. So this also includes holding the crisis line, and they have to go in the ERs and reassess. We reassess every 24 hours when we don't find placement until we find placement. So the next day, we reassess to see, are they still in the same situation? Maybe the 24-hour stay at the hospital changed things. Maybe other family members came up. Maybe they saw their family was supportive. Maybe it made it worse, that kind of thing. A lot of the hospitals have psychiatrists now, except Lompoc and San Ynez, so sometimes they will intervene and provide medication. They don't do that with our youth as much. But if there are present psychotic symptoms, we see that a lot right now, especially the drug use with meth, they'll prescribe something and then I'll stabilize them. But our goal is not to write a hold so we can rescind it. If we're saying someone needs a higher level of mental health care, there's a reason why we're writing a hold. We don't rescind a lot of our holds. Now, in wake of the tragedy of losing our hospital, that might be different now, and I've been trying to, my staff are so trained to safety plan and let's figure out the best resort, but I'm like, maybe we're gonna have to go to we're not sure, write the hold, and we'll see how it is the next day. And that's not our philosophy, but there's not much we can do not having a hospital. Bakersfield takes a lot of our clients anyway. So for here, that's like what, 2 hours, hour and 40 minutes. So it's the same distance to Vista if like clients are on holds here or Lompoc. Santa Barbara, that was a lot closer, and we contracted with Vista Del Mar, so that was a huge resource and to the community. We had a few youth that were there. They were all evacuated. Everyone survived, as you